Hi everyone, I'm Dr. Hajer Mohammed Abd ElHamid. Today we will talk about the diagnosis. It's a very important topic. Everything in dentistry based on very good diagnosis. A successful endodontic treatment plan is based on a very good diagnosis. Definition of diagnosis. It is the art of identifying disease by excluding other diseases with similar signs and symptoms through collection of data and information which are analyzed, then conclusion can be reached. So we have to collect from the patients all the information we need to know or to reach the optimal diagnosis. Diagnosis is very important. If we don't know the cause of the disease, we cannot treat the patient. So we have to collect all the information which will help us to make a very good view to know what's the diagnosis of the problem that the patient has. The purpose of diagnosis determine what problem the patient is having and why the patient is having this problem. It's a very important two questions. What is the problem and why there is a problem? When the patient come to you and he has a pain, so we have to know the pain, why the patients have this pain. Is it a periodontal pain? Is it a pulpal pain? Is it any other kind of pain? So we have to know why the patient is having pain. So we have to ask the patient several of questions to know or to conclude why or what is the problem and why the patient is having this problem. The process of making a diagnosis can be divided into 5 stages. The first stage, the patient tells the clinician why he is seeking the advice. Second, the clinician questions the patient about the symptoms and history that lead to this visit. The clinician performs objective clinical tests and correlate the objective findings, the clinical test or the examination or the clinical examination which the doctor do to the patient with the subjective details which the patient tell us about. For example, he feels pain on sweets. He feels pain when he drink cold water. So this is the subjective details which the patient tell us about it. But the objective findings, when we do a clinical examination for the patient. The clinician formulate a definitive diagnosis after he correlate the objective and subjective details. Differential diagnosis in endodontics require scientific knowledge, interest, curiosity, patience, and sense. This is a very, very important. The interest, curiosity, patience, and sense. This is the skills of the give the doctor a very good skills and the ability to interpret and interact with the patient. When there is a doctor that he doesn't have a very good knowledge, always I'm saying dentistry, it's not just making cavities, just making endodontic treatment. No, it's a science. We have to know all the details and we have to correlate the knowledge which we have and the sense or the how we can make a very good cavity and endodontic treatment. The interest and curiosity and patience of the doctor. We have to hear all the concerns of the patient and we have to hear it very well and correlate it. Sometimes the patient comes to you and he says different or unusual or nonsensible findings. So we have to have the sense also. Is he exaggerated things, or he is saying something like, let's see an example. Some patients come to you and say to you, I have pain in the left upper teeth. And when you make a very good clinical examination, you find that the lower teeth need whatever endo perio treatment, whatever, but not in the upper arch. So we have to have the sense, and we have to have the patience to examine well, to correlate all the signs and symptoms and the findings which we have, and make sense. And the first thing of this of these all, knowledge. Is the patient saying something applicable with our knowledge, or he is confused, or he can't recognize the pain very good? So these are the very, very important requirements for a very good diagnosis. Diagnosis is classified into patient information, clinical examination, laboratory investigation. Let's see first thing the patient information. What is the patient information? General information like the name, sex, address, telephone, all the general information of the patient. The chief complaint, why the patient is coming to the clinic and seeking advice from the doctor, or seeking treatment from a doctor. The medical history, it's very important, and the dental history, the history of the present illness or the present problem. Clinical examination, we have to do extraoral examination, intraoral examination, and we need diagnostic aids. We will talk about these all in details after. Laboratory investigations in case of extraction or another diseases, blood investigation, clotting and bleeding time, and bloodborne infections like the if the patient has hepatitis or any other information like what we said before: name, age, sex, occupation, telephone. Why we are asking this? We need to know first, I think, the name of the patient and age. We correlate some diseases is sex related for females more than males. Occupation, we have to know the occupation of each patient to know the level of knowledge that he has. How we can talk with him, how we can describe our treatment with him, how we can transfer our knowledge or our idea about the treatment plan to him. So it differs from one patient to another. The chief complaint, the symptoms or problems which are expressed in the patient's own words. We have to write the chief complaint in the patient's own words. I have a gum boil. I have a toothache. Pain awakes me from the sleep at night. So we have to write the same words which the patient told us in the chief complaint. Medical history. The clinician should review and update written medical questionnaire about the medication, allergy, if he has any dental problem, any drug problems, any allergy from drugs, any problem from the anesthesia. You have to just let the patient write a consent about his medical history. This enabled the clinician to determine what the medical condition of the patient, and current medication that will alert the manner of performing the dental treatment. Like some patients have anemic patient. If we will decide, now we have a case and we have to decide this case, will go to endo treatment or extraction. So we have to know the medical problems of the patient. Some problems has severe medical problem, like anemic patient, severely anemic patient. Some patients it is taking anticoagulant drugs, so we have to tell the patient to just stop the coagulant, treat the anemia. Some patients need to have a prophylactic antibiotic before the performing endodontic treatment. So all these details must be taken in consideration, and we will discuss every case case by case in the case selection topic. Those medical conditions that may have oral manifestation or mimic dental pathosis need a medical consultation يعني prior to the dental treatment. It's very important to choose the analgesic or antibiotic we give to the patient if he's taking another drugs or treatment, so it will interact with each other, to select also the anesthesia we use to the patient. Allergy. Some patients have a latex allergy from our gloves. So we have to just ask the patient if he has any against anything, drugs or anesthesia or antibiotics. Some patients have allergy to penicillin, so we have to change the antibiotic. Every details is very important to know the medical and give us a preview about the patient. This is a form for the medical and dental consent. The patient must just fill the name, first name, second name, some questions like the telephone, status, city, and also if he has any medicine he is taking, what's the here. We also, if he has any other hypertension, diabetic patient taking an Agulan, just make a circle on the disease. Dental history. We have to know the dental history by asking what is going on, why it is going on, what is the necessary of the resolution of the chief complaint. This is a very important questions, so we will take details after, like we have to know, is the pain present now? Some patient come to you and he says to you, I had pain since 2 days ago, and I took analgesic, and I don't have pain now. Some patients come to you and he says to you that no, I took antibiotics, I took analgesics, and the pain doesn't relieve yet. So we have to know, first thing is, in the moment, has he any pain or not? Nature of pain, it's a very important question. What's the nature of pain? Is it, and the nature of pain, what's the meaning of nature of pain? We have to ask about the location of the pain. Is it in the left or the right, upper or lower? If he can recognize the tooth or not, if he can say the upper six or this tooth is hurting me. Or some patients come to you and say to you, no, all the left side is hurting me, the upper jaw is hurting me. So you have to ask about the location. Second thing about the onset. Second thing about the quality. Is it sharp? Is it dull? Is it very severe? Is it just annoying pain? Duration. How much the duration of the pain. يعني some patients come to you and he says to you, when I drink water, I feel pain for 5 seconds and then the pain relieved. Some patients come to you and he says to you, no, when I eat on this part, I feel pain for it doesn't subside until I take an analgesic. Some patients come to you and say to you, no, I feel pain from 2 days ago and it doesn't subside at all. Also about the onset, when the pain is aggravated, when I'm eating, when I'm drinking, or when I'm laying down, when relieving and aggravating factors also. The relieving factor, when I take the analgesia, so the pain relieved. No, when I just I have severe pain, and when I take any cold water and put it on the tooth, the pain is relieved. When I don't eat on this side, there is no pain. So what is the aggravating and the relieving factor of the pain? It's very important. So the 5 important question in the nature of pain: location, onset, quality, duration, relieving and aggravating factors. This is also a form about all the details of the pain. Questions also, can you locate the tooth? Like I said before, the quality, sharp, dull, or throbbing pain, the frequency, it is constant or intermittent, the nature of the quality of the pain. Do you grind on do you have a night grind? Several question. This is a form or a sample of a form which can help you in what kind of questions you can ask to. Also this, look, if we see in the upper part of the paper, we will see the quality: dull, sharp, throbbing pain. The onset requires stimulus, doesn't require stimulus, spontaneous, location, localized, diffused, referred, a duration, 4 seconds, 4 minutes, 4 hours, 4 days, initiated by cold or hot or sweets or palpation or mastication or sleeping. What is the aggravating and relieving factor? It's a very important form. Always I ask about these forms. You have to read it very well, you have to see the details. Sometimes I ask about the details in these forms. Dental history, past dental history. We have also to ask about the present dental history we talked before about, and the past dental history. Past total dental treatment, if he has allergy before to anesthesia, if he had the bleeding on extraction, if he had past accident or trauma, swelling around the tooth. Some patient comes to you and the past dental history is very important in endo, because 90% of the patient comes to the clinic and he says to you, this patient was hurting me since 3 months ago or 4 months ago, and I took antibiotic and analgesic and the pain is relieved. And when you see the tooth, you will see that the tooth is deeply carious. It's some sort of broken tooth. So our patients here, they need They took antibiotic one time, two times, three times, and then they decided to come to the doctor. So you will see that this tooth has a very, very complicated past dental history. Sometimes patient come to you. Maybe he said to you that I had a previous endodontic treatment in this tooth, and I have pain in this tooth, so I have to make an X-ray to see if it's the endodontic treatment has a very good quality or not. If there is a missed canal, he didn't make a missed canal, the previous doctor. If there is a apical radiolucency on the tooth. So the past dental history is very important. Pulpal pain, very poorly localized. The pulpal pain, it's characterized by thrombing pain. The patient come to you and say to you, I have a severe thrombing pain, intermittent pain, and sometimes continuous pain, intensifying by heat or cold, sometimes during chewing, may be relieved by cold in very advanced dental or severe pulpitis cases, and it's usually severe. Sometimes the patient comes to you with he has a diffuse pain. He comes to you and says to you, I have a severe pain in all the upper left part of my teeth. I cannot recognize the teeth. Sometimes in severe cases, sometimes he comes to you and he says to you, no, I can recognize the tooth. So in severe cases, when the patient comes to you, I cannot sleep at night since 2 days ago. I took medicine, I took medication, I took analgesics, I took antibiotics, and nothing is relieving the pain. So you have to think about pulpal pain. Periodontal pain may be well localized, deep pain, intensified by showing more than anything. يعني the patient come to you and he says to you, in this case, look, it's very important. The first thing that differentiate between the good doctor and the who has knowledge and the doctor that he doesn't know anything and he doesn't have any knowledge, to differentiate between periodontal or periradicular pain and the pulpal pain. This is the first distinguished part. If there is any bridges, if there is any crowns, if the patient come to you with pain on chewing after I eat, the patient come to you and say to you, after I eat, I feel pain. So you have to shift to a periodontal disease. Okay, we can differentiate after with a X-ray, but we have to know, or we have to decide, or we have to take a clue from the patient, from his history and from his chief complaint first, before we do a diagnostic, or how to make a diagnostic aids. Sorry. Periodontal, like we said, intensified by showing, moderate or severe, may be well localized, and it is you will see gingival inflammation. You maybe see crowns, bridges, some very nice clues. The periodontal examination. The examination. What we do in the clinical examination: general examination or extraoral examination, color of the skin, sclera of the eyes, nail, hair, lymph nodes, enlargement, facial asymmetry in cases of swelling or facial swelling, intraoral examination, visual examination, percussion, palpation, probing, and mobility tests. Diagnostic aids, radiograph, and the vitality test, and also the lymph node examination. It's very important to make a lymph node examination, especially if there is any infection, or if there is any endodontic problems. So we will see that there is an inflammation, so we will have a lymph node enlargement. So we have to make an examination for the mandibular lymph. Facial asymmetry. This is the first thing. We are endodontists, so the facial asymmetry is a common feature on the patients which came to the clinic. Localized swelling, sinus tracts. We have to examine all these things to know and to give a very good treatment and patient and make a very good treatment plan. Visual examination, we have to make an intraoral examination by mirror and probe and very good light. Intraoral examination, we will see what in the intraoral examination, like intraoral swelling, tooth discoloration, deep caries, recurrent caries beneath the restoration, fistulas, fractured restorations, traumatic occlusion. The discoloration may be due to a trauma from previous years, and he just it doesn't make any pain, so he leave it, so the pulp become necrosed. We have to make a very good examination for all teeth. Percussion test. It's a very significant test. Always compare tooth. You have to, when we make a percussion test, we compare the tooth with the adjacent tooth, the tooth which we have the problem in it, and with the adjacent tooth to compare the percussion test in both of them. Positive percussion test reveal apical periodontitis or acute periapical abscess. And also cause of inflammation may be pulpal or periodontal. So we will just the percussion test means that there is inflammation in this part. The periapical diagnosis in percussion test. If there is pain, that means that there is a periapical problem. If there is swelling, so we have an acute apical abscess. If we don't have swelling, we have a symptomatic apical periodontitis. If there is no pain, swelling, drainage, sinus tract. If there is no pain, so look, we have to just explain this part. When there is sinus tract, there is no pain because there is continuous relief of the pus in the periapical area, so there is no any pressure on the periapical tissue, so there will be no pain. There will be when there is a sinus tract. When there is so that's why we will see now sinus tract. If there is swelling, drainage through sinus tract, يبقى chronic apical abscess or asymptomatic apical periodontitis if there is no sinus tract. Okay, so we have to differentiate when we see a sinus, so normally will not be any pain. Palpation test. It's very important in the palpation test, extraoral, to detect if there is any tenderness or swelling in the lymph nodes. Intraoral, location of the intraoral swelling, and the patient also on the palpation feel pain on this area. Maybe he comes to you and say to you, I have pain in this area, when you palpate on the painful part on this area. Second thing, the palpation, we need in case of swelling, we have to know the swelling is indurated or fluctuant swelling. If we have a swelling, we have to palpate it. Why? We have to differentiate between the indurated swelling and the fluctuant swelling. What's the difference between the indurated and fluctuant? The indurated swelling means that the swelling is under bone. When we make a palpation, we will feel a hard bony swelling. That means that the abscess or pus just expand the bone, and the swelling is under the bone. In this case, we say we have an indurated swelling, a hard bony swelling. And if we have a fluctuant swelling, that means that the pus past the cortical bone and it is soft. When we palpate the area of the swelling, we will feel it soft under our fingers. So in this case, we will make an incision and drain this abscess. So in case of indurated swelling, hard swelling, bony swelling, we make a trephination. We will discuss this in details after. The trephination means that is we make a hole on the in the bone by a burr and make a drain through the bone. In case of what? In case of indurated swelling or bony swelling. In case of fluctuant swelling or soft swelling, we make just an incision and drain. It's very, very important to differentiate between the both of them. Probing test, this to differentiate between the periodontal and endodontal lesions. Mobility, it's very important. The degree of the mobility, we will decide if we can treat this tooth endodontically or not. If we have a fourth grade or a third grade mobility, so we cannot make a root canal treatment for this case, and we have in this case a periodontal problem, so we have to treat the periodontal problem or extract the tooth. Diagnostic aids. The diagnostic aids, first thing we use the radiograph. We have many kinds of radiograph. We have the conventional method, which is the X-ray film. We have the digital method, which is the RVG, radiovisuograph. Now we have the cone beam CT, the CT. We have now there is a micro CT. There is a several kinds of radiograph examination. It's the panoramic X-ray. It's very important. The radiograph is a very important diagnostic aids for dental treatment. Vitality test. In the vitality test, we have to decide if the tooth is vital or non-vital. So we make a thermal test, electrical pulp test, laser double fluorimetry, pulp oximetry. We can use these two also. Special tests like the bite test, cavity test, staining and transillumination test, selective anesthesia, and Guttaberg test. We will discuss this in detail. The thermal test. In the thermal test, we have two tests, the cold test and the heat test. So we perform a cold test or test. The cold test we performed with endo ice, ethyl chloride spray. We just make a spray on a cotton pellet and put it on the tooth and see if there is any response in this. Or we use the frozen carbon dioxide. We can say it about dry ice sticks also. We can use it. We just make very small sticks and put it in the fridge, and we can use it like ice sticks also. And we put it on the but like the same manner we put it on the tooth to see if there is pain or no. Anesthesia carpools, we can just fill it with the water. We can make the roots like this, or we can do a cold water bath. This detects pulpal condition. Primary method for pulpal testing to be reliable should be combined with electrical pulp test. And we have to be very careful and know how to use this test to don't burn the soft tissue. So it's very, very important, and we have to know if the tooth is vital or not. This is the first thing. Sometimes patients come to you with caries, maybe in sub upper central, and then the patient come to you and he said to you, no, I don't have any pain, I just want to remove the caries, and you just in this case you have to uh, when you see a caries and there is no any pain, you have to just think. Normally, if there is caries or there is an initial caries, the patient must has pain. So if there is a deep caries and the patient doesn't having any response to cold or to water bath or ice roads, so that means that the pulp is necrotic. So you have to confirm if the pulp, in this case, if you just you didn't make a vitality test and go and just make a cavity and put your restoration, the patient will complain with maybe swelling, maybe pain after you make your restoration. What's the record after this cold test? It might be positive or negative. Time until cold sensation was felt. It's very important, and the quality. Is the pain lingering? Is the pain there is no pain at all? If the pain is slight pain. Classical response to thermal cold test: normal pulp is moderate transient pain. When we remove the rod, the pain relieved. Reversible pulpized sharp pain subside quickly, and it does take just 1 or 2 seconds and then it is subsided. Irreversible pulpites, the pain wrinkle and stays for a long time, and necrosis, no response at all. Sometimes there's a false negative or false positive response to the test or the vitality test or electrical pulse test, so you have to confirm with another heat test. It is usually when patient chief complaint is pain upon contact with hot drink or food, and the patient cannot identify the tooth. When the patient comes to you and he says to you, when I drink hot tea, I feel severe pain. So in this case, you just make a heat test. I don't recommend to make the heat test on all. Yani, I prefer the cold test than heat test. So the heat test, we do it just in case of, in this case, when the patient comes to you and he says that I feel pain on hot drinks. With this test, a delay response may occur, so waiting for 10 seconds to reach, because in this case we have a severe pulpitis. Lubricant should be placed, and we have to be very careful doing this. How we can test? We can just do the heat test with a heated gataberka. We just heat a gataberka, or a heated condenser, or by friction, by making a friction with a rubber cup or anything. By green compound stick, we just heat it and then put it on the tooth. But again, I don't recommend this test in all cases, because sometimes this test make irritation to the pulp in case of normal. Electrical pulp test. A direct test of nerve element of pulpal tissue. Vitality versus non-vitality only, not whether vital pulp is normal or inflamed. So in the electrical pulp test, we know the pulp is vital or non-vital. We cannot see if the pulp is inflamed or not. In multi-rooted teeth, it's not applicable, where some canal must be one canal vital and other the canals is not vital, so it gives us a false reading. When we have a false positive reading, it's very important. When electrode contact with metal restoration or gingiva, patient anxiety, when the patient is very afraid, so he will just, when you put a rod on the tooth, he feels I feel pain, I feel pain, and he actually doesn't have any pain. Liquefaction necrosis in case of multi-rooted teeth, failure to isolate or dry the tooth. The false negative reading, patient is heavily medicated. I know patients, they can take 9 pills. Some patients come to me in the clinic and they say to me, I took 9 pills, 10 pills yesterday. I took today, before I come to you, I took 5 pills, 6 pills. So some patients really took a very high dose of medicaments. Inadequate contact between the electrode and enamel, recently traumatized tooth. Never ever make a electrical pulp test in a recently traumatized tooth. Sometimes patients come to you, I have just fall on my teeth now, so you cannot perform this test. Oh, okay, come to and sit on the chair. I will make an electrical pulp test to see if the tooth is still vital or not. It will give you a false reading. Recently erupted tooth and open apex and partially necrosed teeth. The electrical pulp test, like in the picture, has 2 electrodes. The hook, we put the hook on the lip and the rod on the tooth to make an electrical current. Sorry. Laser Doppler fluorimetry. The laser Doppler fluorimetry, we don't use it on all cases, and we mainly use it in the research part. Laser Doppler fluorimetry, we use it on the to assess the blood flow of the pulp. The pulp oximetry, we just measure the oxygen concentration of the oxygen concentration in the blood. We need this special test. Actually, the biting test is very important test. We use the biting test in case of cracks. You will see that the biting test here, it's like a triangle. We put it on the cusp, the palatal cusp and the buccal cusp, and ask the patient to close in it and then open his mouth. He will feel, if there is a crack on the tooth, he will feel pain on what? On closing or on opening? He will feel it on opening of the tooth. After he opens the tooth, he will say, open the mouth, he will say to you, I feel pain on opening. This is called a biting test to know if there is a crack or a fracture on the tooth, in the tooth. Staining, like in this picture, it's a very good method. We use the methylene blue dye to see if there is a crack or caries in the tooth. Transillumination, it's a very good diagnostic aid to see the fracture line and cracks in the tooth. If there is any restoration, like in this picture, and there is a crack, you will see that the transmission of light is stopped in this area. That means that there is a crack in this 2 parts of the, and like this in this picture, it's very obvious also. What's the difference between the grease line and crack? The grease line is in the enamel, and the crack it's propagated into dentine. So if we see a grease line in the enamel, it's not a crack. We call it a grease line. Selective anesthesia. It's a very nice part, or a very nice diagnostic aid, but it's more useful in infiltration anesthesia. We can do it. We can make block anesthesia in case of differentiation between the upper and lower jaw, maybe. But it's more useful in case of infiltration anesthesia to differentiate if one patient came to you and he said to you that there is a pain in my upper left premolar, and you severe pain, I cannot afford this pain. So just if you give him anesthesia in this part, you will ask him after is the pain relieved. So this is also a very good and nice diagnostic aid. Gadaberka tracing. The Gadaberka tracing is very important. We have a swelling. When we have a swelling between two teeth, like this picture, and we don't know the which tooth is making the problem, the first premolar or the second premolar. So we put the Gadaberka on the fistula, or in the opening, and then make a X-ray, and it will just point to the tooth which has the big problem. That is called Gadaberka tracing technique. Laboratory investigations. Like we said before, if we need, we can just send the patient to make a blood investigation, clotting, bleeding, and if there is any infectious diseases like hepatitis or AIDS. If you just need some sort of additional laboratory investigations. This is the thank you. I hope that it's useful for you. Thank you all.